Ubunye Foundation is a community-led organization that works towards sustainable living whilst building resilience to climate change. Ubunye is active in rural areas of Ngqushwa municipality of the Eastern Cape in South Africa. We are community-led, which means all our programs and projects are designed, implemented, monitored, and evaluated by the community. Ubomi Bethu project is an isiXhosa name, which means it's ours, and is run by young women aged between 14 and 24 who attend high schools in the area. In response to the rising gender-based violence, mainly from abuse by older men, building relationships with learners as young as 10 years, exchange money for food, music, and phones for sexual relations. This has led to teenage pregnancies and HIV and STI infections among these young learners. The Ubomi Bethu has 4 parts to it. First, Ubunye staff provide training, mentoring for a team of learners who are called the HIV ambassadors.
My name is Azola. My surname is Ngqushwa. I'm a 21-year-old. I live here in Glenmore location. I'm a youth leader HIV ambassador. The change that is happening is that the percentage of teenage pregnancy has decreased. So I think since they've been trained, they're spreading the right information to their peers.
Hi, my name is Konaboy. I'm 18 years old and I'm in grade 11 at Kaya Senior Secondary School. I'm also a youth TB champion and also I'm an ambassador on HIV program. This program has helped me because I was able to know what is HIV, and I've also have some confidence to go to the clinic and test HIV and TB. And also I have more access to encourage other learners to go to the clinic and get some help so that they can know their status and stuff, so that they can have more information about HIV and TB.
Secondly, these HIV ambassadors have access to a team of professionals, which are social workers, police, nurses, doctors, legal aid workers, and psychologists, to whom which can refer their colleagues for professional support and guidance. Thirdly, Ubunye provides training in life skills for all young women in the program. Here they learn communication and leadership skills, studying aid, building a life plan, and steps and challenges they will tackle.
My name is Yashoma Stirman. I am 18 years old and attend Ghana High School in grade 11 in Dlambe Village. And I am Youth HIV Ambassador. I was trained in life skills with Ubunye Foundation. At the training, we were trained about life plans. In life plans, it is where you plan about your future, your dreams, and your wishes. In life plan, you start with steps. There are steps that you must follow. You must know your dream first and then follow your dream by following the steps.
Fourthly, Ubomi Bethu ensures that the local clinics provide youth-friendly services. This is done by young people being recruited as young or youth community healthcare workers. These YCHWs work at the clinics daily as front of house.
Good day, I am Azande Roy. I am a CHW at Glenmore Clinic that is conducted by Ubunye Foundation for 2 years. Mostly I've learned to deal with the youth and how to treat them, and also how to make them happy and feel welcomed here at clinic.
Their presence have more than doubled the numbers of young people, which includes young men and women, coming to the clinic for assistance. These youth community healthcare workers have also been able to refer young women experiencing violence and trauma to counselors and legal support. Lastly, Ubomi Bethu has a community-led system called YouthWise. This provides all young people in the community with access to information, resources, and materials on reproductive and sexual health. The LGBTQIA+ community, especially young transgender women, have reported on their struggle with their constant emotional and physical abuse and violence and alienation which exists not only in their communities but in the schools and clinics. Ubunye has begun to fundraise for a program to be run by the LGBTQIA+ women to address the multiple layers of stigma they face. Ubomi Bethu works because it is an integrated set of interventions that work together to address the challenges faced by young women, especially HIV and their access to prevention, care, and treatment. However, there are specific challenges that need special attention, like the multiple stigma faced by the young LGBTQIA+ and the growing poverty experienced by families, with the rising cost of living driven by government corruption and climate change. This indicates the crucial importance of the continued community leadership of the Ubunye Foundation in the area.